Hello and welcome everyone to another Women's Health Tech Wednesdays. My name is Nina Joshi and I am very excited to bring on our guest today, Monica Malowney, who is the VP of Life Sciences and Healthcare at NYCEDC. Before we jump in, just wanted to let everyone know that we love questions here at Women's Health Tech Wednesdays. So if you have any, please feel free to utilize the Q&A feature at the bottom of your screen. And so with that, I would like to formally bring on our guest, Monica. Thank you so much for being here today.
Thanks for having me, Nina.
So maybe to kind of kick things off, would love if you could tell us a little bit more about yourself and your journey into the healthcare industry.
Sure. So I think like a lot of people that work in healthcare, the journey started really from a personal story. I have a family member that had a serious mental illness. And I think like other families that have a member of the family with a serious mental illness, it was something that I knew about growing up, but we really never talked about. And so, of course, growing up, I was really curious about it. And that really started my interest in mental illness, mental health. And so I studied clinical psychology as an undergraduate, started working in group therapy, and then started working after that at a veterans hospital in PTSD research. And in both places, I found myself being sort of most interested in access to care, access really to society and opportunities in society for people with behavioral health problems. So decided to get my master's in public health and started working with a researcher at Harvard who was also interested in access to care. So we started doing some unfunded studies. We looked at insurance roles of providers supposedly on insurance companies in network. Mm-hmm. And we tried to make appointments for behavioral health care with them. And what we found, maybe unsurprisingly to folks in the audience, is that it was really hard to get appointments with these behavioral health providers. A lot of the phone numbers were wrong for the providers. And when the phone numbers were right, a lot weren't taking new patients. A lot might have had appointments, many months out. Some didn't take that insurance or didn't take, public insurance of any kind. And so when you think about someone that has, for instance, depression, is it really realistic to think that they're going to call, 10 people in the hopes of getting an appointment? Probably not. So we did that study. We also did a study looking at how long it took to get prior authorization to hospitalize someone that had come into the ER with, that needed to be hospitalized for, behavioral health reason. Mm-hmm. And to get that prior authorization, it has to be a doctor on the phone. They're the ones that have to get the authorization. And it can take a really long time, especially if you're trying to make that call, on a Friday night or over the weekend when, maybe someone isn't on the other end to take that call. So, hours and hours and hours of, physician time are used to make these calls and get this care. So, we found a lot of examples of how it was just in a very practical baseline level, difficult for folks to access care and treatment for behavioral health. And so when I finished graduate school, I started implementing new models of healthcare delivery in primary care called patient-centered medical home. And one of the parts of that model is to train primary care providers to provide sort of baseline behavioral health problems. So think about someone that has, mild depression, mild anxiety, that may need a prescription, may not need a prescription, just training primary care providers in how to do that. There was a lot of resistance, is what I discovered. There's a lot of discomfort around providing care to folks that had behavioral health problems. Little maybe did they know that their patients already have these problems. They're already treating this population. So it's really, it was really interesting experience. From there, started working on New York State's large Medicaid delivery system reform incentive payment program, which included things like implementing this patient-centered medical home model across the state. And I also started working with folks in the workforce space, because when you're changing the way that you're delivering healthcare, you're changing the way that people do their jobs, you're creating new jobs. And some really interesting things came out of that, including examples of folks that, may have been Medicaid recipients themselves, Medicaid beneficiaries themselves, who, were able to get, a job as a community health worker. Wow. Or, as a peer counselor. And because they were making a living wage now, no longer needed Medicaid. So they were just amazing stories. And, I got really interested in workforce. So joined CUNY, the City University of New York's central office in their Department of Workforce Programs and Continuing Education, and started working on workforce partnerships in the health and life sciences. From there, I landed at EDC, where I am now. That's the New York City Economic Development Corporation. And I work in our life sciences and healthcare initiative. And one of the things that we're really focused on for the future is workforce for the life sciences industry in New York City. So that's sort of my journey and how I got here.
Well, I love that. That's quite a journey. That is incredible. And I think just being able to see really how you've navigated, starting with, clinical psychology and kind of ending to really the bigger picture in health in general, I think is really fascinating and quite inspiring. I know we'll definitely have a lot of questions I want to ask you about the workforce component. But you had mentioned something, a little bit early on in your career with the work that you were doing around, access and prior authorization, and really just a lot of the barriers that you've seen within the healthcare system. Would love to ask, as a public health professional, what are some of the key issues that health and tech professionals really should be focusing on when implementing, services and care specifically to the patient? Are there any specific areas that you've kind of seen where, there still needs to be some work done or just visibility?
I think, just being aware of these populations that may have a harder time accessing care for any number of reasons. So I think being aware that, not everyone speaks English well, being aware that folks have any number of, visible or invisible disabilities that may make it harder for them to access care. Just really having those different folks in mind as you design an intervention, I think is the most important thing. I think community engagement is hugely important. So, really trying to talk to, the end users of, whatever innovation or new service it is that you're designing or implementing, and really trying to understand, what would the barriers be that we need to think about overcoming as we design. So I think it's really just about having those different populations in mind. Something that, a conversation I had recently, I work closely with the New York City Department of Health on the Pandemic Response Institute that we're trying to set up right now. So this is a public-private partnership. Columbia University was selected to operate this new institute that would help New York City be better prepared for future health emergencies. And so we've been having a lot of conversations about, what's happened, over the last 2 years in New York City. Right. And, again and again, a barrier that came up was, folks didn't have good internet access. So, telehealth was like the huge story, right? During COVID. And I don't think we're going to go backwards from there. But how do you serve people that don't have a smartphone or don't have reliable internet access? So, I don't think I have the answers other than to just, have those vulnerable populations in mind
Yeah.
during the design phase.
That is, I really like how you're kind of talking about make sure you design for all when you do design something. I think that piece is really important. And I would like to learn a little bit more about, some of the things that, we can do when it comes to facing those barriers. So I know that EDC, you have a lot of partnerships. I would love if you could expand a little bit more on that and how you've been able to leverage things like that to, solve those barriers.
Yeah, so one thing that is part of EDC's mission is to really think about equitable economic growth. And so how do we strengthen New York City's economy while making sure that, folks, like all New Yorkers, really can take part in the benefits of that. And so, as we think about equitable economic growth, one thing that comes up a lot is, who has equity in new companies that are being created in New York City? Who's benefiting from good jobs that are being created in New York City? And I think often BIPOC individuals are not benefiting, even though New York City, is an incredibly diverse place. Mm-hmm. We have issues actually targeting for instance, women or people of color when we have certain programs, because we are a government organization, and over the last couple of years, a lot of judges were put into courts that are taking cases related to things like reverse discrimination. So we have to be really careful about our programming, and we have to be really thoughtful about how do we actually reach the populations that we know, have been traditionally left out when it comes to, equity opportunities and things like that. So we have made good progress, and I think we've been very successful at creating public-private partnerships. So partnerships with private organizations that, can more easily explicitly target, for example, women and people of color with programming. One recent example is the X-Seed Award created by Deerfield Management. It was made possible through support that we gave to an innovation campus that they recently completed in Manhattan. But they run this program, the X-Seed Award. It's for underrepresented founders in the life sciences. They compete for $100,000 in seed funding. And they've already given out, $1 million in seed funding in just 2 years. So it's been a great program. And so, we have to be creative in how we do programming. And, we have to think about how we can use private partners. We have to think about how we market, how we do our outreach, and how we engage the populations we really want to reach.
Absolutely. I like the idea of, creativity and being agile. That's how you get things done. Absolutely. And then one of the things, I really wanted to touch back on, as you were really giving us and sharing with us your healthcare journey, you had talked about the work that you're doing right now as it relates to workforce development. Would love if you can discuss a little bit more about the impact of workforce development specifically on healthcare, health outcomes, and some of those long-term effects. And then also, why is this an important investment to make in terms of, time, effort, dollars, et cetera?
Yeah, well, it is an investment when you want to do workforce programming. It is. Well, as a public health professional, I think one of the first things that you learn when you're studying public health is that healthcare accounts for a very small amount of a person's overall health. Mm-hmm. And but where they live, their access to healthy foods, and whether or not they're working, those are much bigger impacts. And a lot of that really comes down to income. A lot of it comes down to race, because there is still racism that affects people's health, right? So that was really, I think, why, I saw that in action, right? When I was working on the Medicaid delivery program in New York State and actually with other states as well. People, who have jobs that pay them a living wage, they can they can afford, healthy foods. They can afford to live somewhere where they have access to parks and can get outside and exercise, right? They maybe are living in just better quality housing overall, so they don't have asthma, because they're not next to the freeway. So that was really, I think just as a public health professional, workforce investment, I think is worth it. And
I mean, it seems like it's one of those things where you really kind of get that bigger picture of how, I like how you said that healthcare really does not account for
Right.
a lot. And I think just when you kind of contextualize it, I think that just made so much sense for me about the need to really think about more of like the holistic view of a person rather than the minute they step into a healthcare system as a patient.
Right. And I feel like the healthcare system, it's starting to pick up on this, right? So we're seeing like doctors prescribing fruits and vegetables, and giving you tokens to go to your farmer's market or things like that, or prescribing you, to do some exercise. So I think that we're getting there as, a health system, and we're starting to understand that. But when we look at where the dollars go, it is still mostly into the healthcare system and not into the public health system.
Yeah, absolutely. And so speaking of, your work to kind of combat a lot of this stuff, I know that, EDC is such a large organization that advocates for so many different areas of growth. Would love if you could share any opportunities that our audience should know about in terms of any of the programs, any of the initiatives that you currently have running.
Sure. Well, for anyone at a startup or, in the life sciences industry, in the health tech industry, I would first want them to know about our internship program, because we are very actively looking for companies that want interns. So we help subsidize the cost of interns for small companies, for lab-based experience, and for students that come from the City University of New York, which is it's New York City's public university system. And most of those students are students of color, are first generation college students. Most of them, have to work for money. So we help subsidize the cost of those interns. And so definitely want folks to know that we can help you find an intern. Awesome. Another program I'd want those companies to know about, startup companies to know about, is something called our expansion fund. So this is a fund that we have for companies that are looking, maybe they're in an incubator right now, but they need more space, but they're not really ready for like a huge commercial life sciences space or, other space. We have an expansion fund to help you create that space and outfit that space. And then lastly, we have an open procurement right now for workforce programs. So it's pretty open-ended. It's a request for expressions of interest. And we're really looking to fund programs, that are either improving STEM education, increasing the number of students that are graduating with life sciences degrees from college, or, otherwise helping people get to work in the life sciences industry. Because we know that jobs in the life sciences industry pay better than, your average job in New York. And that's, across all education levels. So, so those are some opportunities. I would say check out our website. It's lifesci.nyc. And we have a lot of other incentives we can tell you about as well.
That's it. Well, that's amazing. So definitely everyone on the call, if you're a small business, there's lots of great resources for you. That's amazing. So wanted to quickly, I see some questions, and so just wanted to have the opportunity to ask you before we kind of get into our final question of our session. So the first one is, are there any quick pointers for a successful COVID-19 vaccine equity program? So is there anything that you've kind of seen from your experience?
I think that, I actually think New York City did a good job in getting the word out about vaccine, getting into communities with, information in, many languages, popping up vaccination centers all over, working with pharmacies to provide vaccinations.
Oh no, Monica, I think I lost you for a second. Oh no, Monica, it looks like she is frozen. Let's give her a second just to maybe hop back on. Oh, okay. Oh no, we'll give her a minute just to hop back on. But if there are any questions, please feel free to continue adding them to the chat. And Monica, I see that you're on.
I'm back, sorry.
No, no worries. I wanted to give you the opportunity to continue, what you were talking about vaccines and kind of the implementation of that.
I would say check out what New York City Department of Health has done in this area. I think they've done a lot of amazing work. And I think that they've begun publishing research on this as well. So I would say look at our Department of Health.
Awesome. And then also wanted to got a question around what direction do you see health tech moving in based off of kind of some of the things that you are experiencing. And I think I would love if you could even put on like your public health hat to kind of see if there's maybe a direction that you want it to move in.
Yeah, I think that's probably the best answer I can give. I would love to see health tech move in a direction where we are really seeing these amazing innovations in health tech benefit people that really need it. So I would love to see health tech companies figure out, how to get Medicaid reimbursement for their innovations. I would love to see them work with, community-based organizations and other experts with, within vulnerable communities to figure out how do I get this into the hands of people that could really use this innovation. So I would love to see things go in that direction. I would love to see, payers figure out, how to work with these companies too, if you're working on the payer side. So I'd love to see sustainable solutions to really make these innovations accessible to people.
Absolutely. I think that is an amazing calling card, as a lot of the innovators on this call as well. Wanted to ask you kind of our final question of the episode. What is the best advice that you have for, the future health tech or current health tech leaders and founders kind of on this call? Or what was kind of the best career advice that you got that has really stuck with you?
I have been thinking about this, Nina. What advice do I have to offer? And I would say that something that I'm sure has been talked about on other Women's Health Tech Wednesdays is imposter syndrome. I saw it a lot when I was at CUNY, when I was at the City University of New York with our students. I felt it myself. I think a lot of women feel that. And I think if you come from an academic background or you've spent a lot of time in academia, you're sort of trained to think that, you start to think like, well, I really don't know everything about this topic. It's sort of like ingrained in you to think that way, to always be, looking at what you don't know and trying to answer those questions, right? It's like the more you learn about something, the more you realize you don't know. Mm-hmm. But when it comes to the working world and when it comes to like everyday life, you know a lot.
Yeah. And
you have a lot of experience and, you are an expert in whatever it is that you're an expert in. And I don't know if that can be chalked up to any particular advice, but I would just say that you have expertise and you have value no matter, what background you're coming from. And, I would just encourage everyone to bring that to anything that they do.
Yeah, I think we actually haven't heard that advice in a while about imposter syndrome, but it is very true. And so I love that you kind of called that out and really spoke about just, sometimes you need that like self-talk, that self-reminder of, this is the work that I've accomplished. Like this is, my accomplishments speak for themselves in terms of, my seat at the table.
Right. And yes, I think you're right. Like when you have that seat at the table, also speak up, right?
Yeah.
Don't let everyone else do the talking, share your perspective. So
I think that's incredible. So I know we have a little bit of time, and there's just a couple more questions that I want to see if we could squeeze in our time together.
Sure.
So the first one is specifically around EDC. We have a question asking, is the EDC doing anything specifically focused on like aging and health? And if so, are there any programs?
We are not doing anything specifically around aging and health. I would say that aging and health is very much on our minds. You asked the question, Nina, earlier about, trends in health tech, where is it going? And I would say that we have to deal with, the fact that we have an aging population. We saw how vulnerable people are in these congregate settings like nursing homes. And we think a lot about, the current system relies on these home health workers that were extremely vulnerable during the pandemic. They are not paid a living wage for the most part.
Mm-hmm.
They're not even paid for all of the hours that they work. So, I would say that it's on our minds very much. And we're constantly having conversations with others in New York City government about what we can do to really show that we value home health care and our home health workers.
Absolutely. Thank you so much. I just had to squeeze one last question.
Sure.
Well, I wanted to just take a moment to thank you so much for providing the time and really sharing a little bit more about the work that you're doing, but really, reminding us of the bigger picture of health in general, and really, making sure that we take a systems view when it comes to tackling some of these barriers for those that need it most. So really appreciate you hopping on today.
Well, it was a pleasure to be here. So thanks for having me.
Awesome. Wanted to let everyone know that our session next Wednesday is with Witham. We'll actually be doing more of like an office hour session around taxes, everyone's favorite topic. So please feel free to hop in with your questions next week. Also wanted to give a quick reminder about our digital health symposium on March 31st. So please be sure to register. The information will be in the chat. And then one last huge shout out to Monica. Thank you so much for taking the time. We really appreciate and learned a lot from our conversation today.
Thanks again. Take care.
Thanks, everyone. Would also like to give a quick thank you to our sponsors, Goodwin and Witham, for sponsoring this conversation. And thank you all for joining. See you next Wednesday. Bye, everyone.